Hi guys, I'm back again today with another video, and today we are checking out Americans guess the cost of British healthcare. So before we do start, don't forget to subscribe, click the bell button, and let's begin. Well, they do pay taxes, which in return allows them to have free healthcare. I think that's how it works, but maybe I'm wrong, so we're gonna find out. Let's get it.
This US country, it's nothing but a strip club. It's nothing but hustle.
What?
We can have all this. We should be able to have good health care.
Universal health care should be, something we all should strive for. We nickel and dime each other here, and people don't realize.
It might not look like it, but we're in Dallas, Texas. In terms of healthcare, this city is the least insured in America. Around a quarter of
Oh.
people don't have any cover at all. We're going to talk to regular Texans about the NHS and the cost of their medical bills. What's an average medical bill for a regular Texan? How much might that person be paying for their premium and their regular bill?
Let's say you break your arm. Regularly in the rest of the world, that's a couple $100s. Here in Texas, easily $2,000, $3,000.
Could I ask you then to guess how much it might cost in
Wow. Uh, $2,000 to when you break, not to break your arm, but when you break your arm is crazy. That is too much. Here, probably like 300, 400, 500. Okay, maximum 500. Depends which hospital you go to.
the UK? If you broke your arm, that situation, how much do you think someone has to pay in order to have that fixed?
$200.
It's totally free.
Totally free. Wow.
I can tell you, I've got a busted shoulder, and I can tell you exactly how much it costs.
Do you mind?
Yeah, sure. It was $5,000 just to have a doctor look at my broken collarbone. Just
Right.
to look at my broken collarbone.
You had to pay that on arrival.
No, my insurance covered the majority of it, but my portion of it was about just shy of $3.
Wow.
So yeah,
And then presumably ongoing physiotherapy, things like that.
that part's pretty much covered by insurance, but I have really, really good insurance.
Okay,
So
And is that through your job?
yeah.
Sometimes our jobs provide, but sometimes they don't.
What's the case for you? Do you have insurance?
No, I don't.
Okay.
No, I don't.
So if something happens to you need healthcare.
We have to pay full price.
Right.
Yeah,
And that can be very expensive.
it can be very expensive.
Would you like insurance? You'd like to have that healthcare?
I would like to have one, but sometimes we can afford it.
Right now, I'm about to go to Mexico. Tomorrow, I'm going to travel for 2 weeks because I'm going to have some dental work done.
Okay.
Only because here in the States, it will cost me like $10,000.
$10,000 for the dental work here in the US. Do you mind me asking how much it's going to cost you in Mexico?
About 1,000.
Wow. So 10%.
Wow.
Yes,
And the quality of care as good?
that's good or even better.
Wow.
Going to see the doctors, a couple $100 if you don't have insurance,
Right.
just to get a checkup.
It's very obvious
What?
to someone like me. First time in this city. It's clear there's a lot of money here. Big buildings, offices, nice cars. It seems like there is the money to be able to create this kind of system.
Right.
So why do you think there isn't that level of healthcare?
I believe there is.
Okay.
That's the catch. I think that's the risk, but they just haven't allocated that money for the people.
We can have all this. We should be able to have good health care for all.
There's two versions really being offered here, isn't there? Trump is offering something quite different.
I have a question. Is it allowed to kind of like go to Canada and have your like checkups and stuff? Or go there for healthcare purposes? Not healthcare, but like doctor, hospitals, yeah, healthcare. Um, or is there ifs and buts? I don't know. Like, does Canada allow Americans to go there, and vice versa? Does America allow Americans to go elsewhere for healthcare stuff? Because if it was expensive, I would rather go to Canada. Or Mexico, if I'm allowed, right?
To Joe Biden in terms of health insurance.
Okay, let's go
It's
back.
for the people.
We can have all this. We should be able to have good health care
for all. There's two versions really being offered here, isn't there? Trump is offering something quite different to Joe Biden in terms of health insurance. Do you have a preference? Do you think there's one that's better than the other, or do you think the system at the moment?
I don't think there's none differences. I mean, it's all business. So pretty much as far as I have learned, which I'm 34 years old, this U.S. country, it's nothing but a strip club.
Okay, sure.
Sure, I mean, it's nothing but hustle. So that's what they're doing out there. They're just hustling. They really don't care.
You think it's the healthcare companies, the politicians, they're all sort of, it's about profit.
Yes.
Universal healthcare should be, something we all should strive for.
I'd like to see some healthcare changes. We need massive overhaul.
Okay.
It's not just about universal or anything else. It's insanely expensive regardless. Start there.
Do you think that there's much political will in this city for that to happen? Do you think broadly people want that to be the case?
In the city, yes.
Okay.
In the urban areas, yes. Suburban areas, they're typically more conservative, and they're not really sure exactly what all that entails, and so they're not going to do it.
My understanding is that people are generally sort of opposed to taxation here.
Yeah, but it's more, you start screaming about socialism more than anything. So that's really what they're going to do.
Rather than perhaps engaging with it as an idea.
Exactly. Rather than actually thinking about it logically.
We can afford it as a country to take care of each other. And these nickel and dimings of these procedures that are costing thousands of dollars just aren't that expensive everywhere else in the world. We nickel and dime each other here, and people don't realize what universal health care means. Yeah, you'll pay a little bit more in taxes, but you're saving thousands at the doctors. And people really need to be educated on that, and they just don't want to be.
Wow. My parents came home this Christmas and New Year, and my mom did her dental stuff here. So cheap. So freaking, even I was shocked. Like, I was shocked that I live here because she said she would pay like 2000 USD or 1.5, but she paid $300. I was so shocked because I was thinking that type of procedure, like she got her whole lower tooth, like she got it replaced, right? And it's only $300. And it was so much better than the one that she did in the States. It was more comfortable. It looked nice. It kind of like fixed uh her bite because it was kind of like the one that she got in the US was kind of like an overbite, but here it kind of like aligned it. So crazy. It's crazy. I was so shocked because I was thinking, okay, maybe she's gonna pay like 40,000 pesos, which is like $800. But she paid $300 because I was like, if you're getting a whole set of teeth, it must cost a lot of money. But it wasn't. I was like, what the fudge? I was so shocked. And the teeth were like so nice too. Should I just remove my whole teeth and get uh false teeth? But anyways, beautiful peeps. Yeah. Let me know what your thoughts are on this. And if you like the video, don't forget to give this video a thumbs up, subscribe, and I'll see you in the next video. Bye.